Welcome to On Call with Dr. Anselm Anyoha. Today's episode focuses on a topic that touches many families and often raises more questions than answers. How to maximize care for children living with disabilities, including autism. Disabilities in children can take many forms. Some are physical, some are intellectual, and others involve a combination of both. They may be present at birth or develop later in life. Infections, complications around birth, accidents, and serious illnesses can all contribute. Children born prematurely, especially those born very early, may face developmental challenges that follow them into childhood and beyond. For many parents, the hardest part isn't just the diagnosis, it's figuring out what to do next. Navigating healthcare systems, schools, therapies, and services can feel overwhelming, like trying to assemble furniture without the instructions and missing a few screws. But with the right knowledge, strong advocacy, and coordinated support, children with disabilities can grow, learn, and thrive. In today's conversation, we'll explore what these disabilities look like, how they are identified, and most importantly, the interventions, supports, and resources that truly make a difference. Let's break it down, make it practical, and replace uncertainty with clarity and hope. In today's conversation, we'll explore what these disabilities look like, how they are identified, and most importantly, the interventions, supports, and resources that truly make a difference. Let's break it down, make it practical, and replace uncertainty with clarity and hope.
Dr. Anyoha, when we talk about disability in children, what kinds of conditions are we referring to?
When we talk about disability in children, we're really referring to a broad and diverse range of conditions that can affect how a child moves, learns, communicates, or interacts with the world around them. Physical disabilities include conditions that affect the body's structure or function. These can range from congenital differences, such as cleft lip or cleft palate, to musculoskeletal conditions like severe bow legs or limb abnormalities. Some children may have medical conditions that affect basic functions, such as feeding or breathing, requiring feeding tubes, oxygen, or ventilatory support. Others may rely on wheelchairs, braces, or walkers, or need assistance with standing, walking, or daily activities. Intellectual disabilities involve differences in brain development or function. Children with these conditions may have difficulty understanding information, communicating effectively, problem-solving, or learning at the expected pace for their age. These challenges can affect school performance and daily independence, but with the right support, many children continue to grow and make meaningful progress. We also recognize sensory disabilities, such as hearing loss or visual impairment, which affect how children receive and process information from their environment. These conditions can influence speech development, learning, and social interaction if not identified and supported early. Finally, there are neurodevelopmental conditions, such as autism spectrum disorder, which often involve a combination of challenges in communication, social interaction, behavior, and sometimes motor or sensory processing. Autism reminds us that disability is not always visible, but it can significantly affect how a child experiences the world. Overall, disability in children is not a single diagnosis, it's a spectrum. Each child's strengths, challenges, and needs are unique, and early identification, family support, and appropriate interventions can make a profound difference in outcomes.
When families hear the word disability, one of their first concerns is understanding why it happens. Can you help us understand what causes disabilities in children, whether they begin before birth, occur during delivery, or develop later in childhood, and whether there are factors parents should be aware of or watch for early on?
Disabilities in children can arise from several pathways. Some are congenital, meaning they are present at birth. These often result from genetic factors that affect how the brain, muscles, or organs develop. Others occur before birth due to challenges during pregnancy, such as maternal infections, poor nutrition, exposure to harmful substances, or inadequate prenatal care. Disabilities can also be acquired after birth. Complications around delivery, serious infections in infancy, head injuries, or accidents later in childhood can all interfere with normal development. Certain medical conditions, when not recognized or treated early, such as untreated hypothyroidism, recurrent seizures, or chronic systemic illnesses, may impair physical growth, learning, or cognitive functioning over time. The critical takeaway is this: early recognition and diagnosis are game changers. When concerns are identified promptly and interventions begin early, children have a much better chance of reaching their full potential. In pediatrics, timing isn't just important, it's everything. Think of it as catching the train at the station, not chasing it down the tracks.
For many families, the diagnostic process can feel confusing and even intimidating. Could you explain how intellectual and physical disabilities are identified and diagnosed, including what parents might notice at home, what pediatricians look for during routine visits, and how schools or early intervention programs help confirm a diagnosis over time?
Diagnosing a disability often starts with a simple but powerful moment. Someone notices something doesn't seem quite right. Very often, that someone is a parent. A child may not be talking, walking, responding to sounds, or making eye contact at the expected age. Trusting those instincts is important. Parents are usually the first and best observers. Pediatricians also play a key role. During routine well-child visits, we track growth and development over time. If a child is not meeting developmental milestones, that raises a flag and prompts further evaluation. In the United States, this process begins very early. All newborns undergo screening tests shortly after birth to detect certain conditions that could affect physical health, hearing, brain development, or learning. These screenings allow us to act early, often before symptoms become obvious. As children grow older, schools become important partners. Teachers and school psychologists may notice learning, attention, social, or behavioral differences. They are often involved in identifying conditions such as autism spectrum disorder or attention-related challenges and can recommend formal evaluations. There are also early intervention programs, commonly called birth to 3 or 0 to 3 services, that specialize in evaluating infants and toddlers. These programs assess communication, movement, learning, and daily functioning to determine whether a child qualifies for support. A formal diagnosis matters. It is not about labeling a child. It is about unlocking help. A diagnosis opens the door to therapies, educational services, accommodations, and community resources that can make a meaningful difference in a child's development and quality of life. In short, diagnosis turns concern into action, and action into progress.
Once a child receives a diagnosis, many parents wonder what the next step should be. Could you walk us through what typically happens after a diagnosis is made, including early interventions, therapy options, school-based supports, and how families can begin building a care plan that helps their child reach their full potential?
Once a diagnosis is made, the next step is intervention, and this is where real progress begins. A diagnosis is not the end of the road, it's the starting line. Children with intellectual or physical disabilities do best when they receive coordinated, team-based support tailored to their individual strengths and challenges. Intervention usually involves referrals to specialists who focus on specific areas of development. For example, speech-language pathologists help children with speech, language, and communication difficulties. Audiologists assess hearing because even mild hearing loss can significantly affect learning and speech development. Occupational therapists work on fine motor skills, coordination, sensory processing, and everyday activities such as feeding, dressing, and writing. Physical therapists support gross motor development like sitting, standing, walking, balance, and overall strength. When emotional or behavioral concerns are present, behavioral health specialists can help address anxiety, depression, attention difficulties, or disruptive behaviors. Schools are also essential partners in this process. Educational evaluations help determine what support a child needs in the classroom. Through special education services, parents can request formal plans such as an Individualized Education Program, IEP, or a 504 plan. These plans are designed to level the playing field and may include one-on-one support, small group instruction, extra time for assignments or tests, quieter learning environments, or specialized teaching strategies. The goal of all these interventions is the same: to help each child reach their maximum potential, academically, socially, emotionally, and physically. When families, healthcare providers, therapists, and schools work together, children are given the best chance not just to cope, but to thrive. And yes, it truly does take a village, but a well-coordinated one.
Autism is often mentioned frequently as increasing number of children become diagnosed with autism. What therapies are available for children on the spectrum?
As more children are diagnosed with autism, families naturally ask, what can actually help my child? The good news is that there are effective, evidence-based therapies that support communication, learning, behavior, and social connection. Most children on the autism spectrum benefit from speech therapy, which helps with understanding language, expressing needs, and developing social communication skills. Occupational therapy is also common, especially for challenges with sensory processing, fine motor skills, daily living activities, and emotional regulation. For some children, more specialized therapies are helpful. One widely used approach is applied behavior analysis, ABA. ABA focuses on reinforcing positive functional behaviors, such as communication, self-care, and learning skills, while reducing behaviors that interfere with development. The goal isn't to change who a child is, but to help them function more independently and successfully in daily life. Another valuable approach is DIR, Developmental Individual Differences Relationship-Based Therapy. DIR emphasizes a child's social-emotional development, focusing on building relationships, engagement, and emotional connection as the foundation for learning. Many families appreciate this model because it meets children where they are and builds skills through meaningful interaction. For children who have difficulty speaking or who cannot speak reliably, augmentative and alternative communication, AAC, including speech-generating devices, can be life-changing. These tools give children a voice, allowing them to express needs, choices, emotions, and ideas. While insurance companies may hesitate to cover these devices, their benefits often far outweigh their cost. Communication reduces frustration, improves behavior, and enhances learning. In my experience, these devices are not luxuries, they are necessities for the right child. This is where advocacy matters. Parents should feel empowered to ask questions, request evaluations, and push for appropriate services. Pediatricians and pediatric providers also play a critical role by advocating strongly for therapies and devices their patients need. When families and clinicians work together, access improves, and outcomes do too. In short, therapies don't erase autism, but they unlock potential, and every child deserves that key.
What role do parents play in this process?
Parents are not just participants in this process. They are the engine that keeps it moving. No one knows a child better than their parents, and no one is more motivated to fight for what that child needs. From requesting evaluations, to following up on referrals, to insisting on appropriate school support, parents are often the strongest and most consistent advocates for their children. Navigating healthcare, education, and social service systems can be overwhelming. Forms, appointments, meetings, and acronyms that seem to multiply overnight. Partnering with social workers, care coordinators, and case managers can make a huge difference. These professionals help families understand available services, connect with community resources, and avoid getting lost in the system. Because nobody should need a PhD in paperwork just to help their child. What happens at home is just as important as what happens in therapy. Parents reinforce skills learned in speech, occupational, physical, or behavioral therapy by practicing them during everyday routines. mealtime, playtime, bath time, and bedtime. These real-life moments are where learning truly sticks. Siblings also play an important role. They often model communication, social interaction, patience, and inclusions, sometimes more effectively than adults do. With guidance and support, siblings can become powerful allies in a child's development while still having space to be kids themselves. Ultimately, supporting a child with a disability is a team effort. Parents, siblings, healthcare providers, therapists, educators, and community support all working together. When parents are informed, persistent, and supported, children are far more likely to thrive. And while the journey may be demanding, parents should remember this: their advocacy changes lives, starting with their own child's.
You've mentioned communication devices as being especially powerful for children with both intellectual and physical disabilities. For parents who may not be familiar with them, how exactly do these devices help?
Augmentative and alternative communication devices, often called speech-generating devices, can be truly life-changing. For a child who struggles to speak or cannot speak at all, these devices provide something fundamental: a voice. With pictures, symbols, or typed words that are spoken aloud by the device, a child can express needs, thoughts, feelings, and choices. For a child with autism or other developmental challenges, being able to communicate reduces a tremendous amount of frustration. Imagine knowing what you want, but having no way to say it. Anger, withdrawal, or behavioral outbursts often come from that place. When a child can finally say, "I'm hungry," "I'm tired," "I don't like this," or "I want to play," everything changes. Behavior improves, confidence grows, and learning accelerates. These devices also support social and emotional development. Communication allows children to connect with parents, siblings, teachers, and peers. Once communication opens up, we often see progress spill over into other areas: better engagement, improved attention, stronger relationships, and increased independence. I have advocated for these devices for many families, even when insurance companies were hesitant or slow to approve them. In my experience, the benefits far outweigh the costs. These tools are not shortcuts or crutches, they are bridges. Bridges to understanding, to connection, and to opportunity. When a child gains a voice, they don't just learn to communicate, they learn that they matter. And that realization can change the entire course of a child's life.
Families hearing all of this may be thinking, this sounds like a lot. What are some of the biggest challenges families face while trying to manage care for a child with a disability?
One of the biggest challenges families face is simply juggling everything at once. Parents are balancing work, caring for other children, managing household responsibilities, and coordinating multiple medical and therapy appointments. Add school meetings, paperwork, and insurance hurdles, and it can quickly become overwhelming, even for the most organized families. This is exactly why schools and social workers are invaluable partners. Schools help provide structure, consistency, and accommodations that support learning and daily functioning. Social workers and care coordinators help families navigate complex systems, connect with community resources, and access services and financial support that families may not even realize are available. Families also face emotional challenges. Stress, fatigue, guilt, and worry are common. That's why persistence and advocacy are important, but no family should try to do this alone. Asking for help is not a sign of weakness. It is a strategy for survival and sustainability. Avoiding burnout is essential. When parents take care of themselves and accept support, they are better able to care for their children. With the right mix of professional help, school-based support, and community resources, families can move from simply coping to feeling more confident and supported. The journey is demanding, but with help, it doesn't have to be isolating.
As we wrap up, what final message would you like to leave with parents raising children with disabilities or autism?
My message is one of hope, strength, and advocacy. Disabilities, whether physical, intellectual, or development, can bring real challenges, but they do not define a child's worth or limit their potential. What makes the greatest difference is not perfection, but early recognition, tailored interventions, and persistent advocacy. Parents should never underestimate the power of their role. Your voice matters. Your persistence opens doors to therapies, to educational support, to technologies that give children a voice and a future. Progress may feel slow at times, but small steps taken consistently can lead to remarkable outcomes. Remember, you are not alone. Schools, therapists, social workers, healthcare providers, and assistive technologies are tools meant to support, not replace you. When these supports work together, children are given the opportunity not just to manage, but to thrive. Every child is unique. With the right support, children with disabilities can grow, learn, build meaningful relationships, and become valued, contributing members of their communities. Their journeys may look different, but different does not mean less. Thank you for joining me on Call with Dr. Anselm Anyoha. If this conversation resonated with you, please share it with families who may benefit. Until next time, stay informed, stay compassionate, and keep advocating for the children in your care. They're counting on us, and honestly, they inspire us too.